Boom. And we are live with another episode of the Brownwater Banter podcast. I am Jared Seymour.
My name is Joey Cates.
And we have Amber Olsen on the show today to talk about the fourth annual Zebra Run. It's for to raise awareness for rare diseases. We're going to be talking about all of that this evening. It's going to be a really good show. But before we jump into that, like we always do, we want to mention our sponsors. The first one being Southern Magnolia Smiles. It's a locally owned and operated dental office here, ran by Dr. Robbie Williams, a good friend of ours. If you're looking for a great local dentist, we'd really appreciate it if you went over there and checked them out. You're not going to be disappointed. They're on all the social platforms at Southern Magnolia Smiles, Instagram, Facebook. Look them up. If you want to check them out on their traditional website, that's southernmagnoliasmiles.com. Give them a call at 228-215-1202. Great group of people over there, keeping everybody safe during all these COVID times. So go check them out if you need some dental work done there. And our new sponsor that just came on board is Hilltree Marketing. That's Jesse over at Hilltree. They do website and graphic design, social media management, IT services, videography, and aerial cinematography. They have a drone and they do some really cool drone work. They've worked with some local businesses around here doing their website management, and they're actually going to be doing ours here in the very near future.
Yes.
So if you're a small business, or you're just for any personal reasons, you have a website that you like overhauled, maybe brought up to speed. They do really, really, really good work. So check them out. Let's see. Do we have just go to hilltreemarketing.com. You can take a look at some of the work that they've done. And I don't think you're going to be disappointed. So
No, they do good work.
Yeah, they do really, really good work. Let's bring Amber in here and let's talk about the Zebra Run. Amber, how are you doing today?
Hey, I'm good. How are you guys?
We're doing great. So tell us, I mentioned it already here. We have the fourth annual Zebra Run. I'm going to flash this graphic real quick right out of the gate so people can see it. The fourth annual Zebra Run for rare diseases. It's going to be April 17th this year, 2021. It's a 5K and 1 mile fun run to bring awareness to rare diseases. So can you kind of elaborate on that for us?
Sure. So I live in Ocean Springs and I have 3 kids, and my youngest one is now 7. And 5 years ago, she was diagnosed with a very rare condition called multiple sulfatase deficiency. So I didn't know anything about rare diseases or the rare disease world at all before this. And her disease is genetic. And my husband and I are both carriers of this bad gene. Our other girls are fine. But when Willow was born, we didn't know anything was wrong until she was about 2. She started having a little bit of balance issues. She was walking and running, but kind of had trouble balancing, and she's never talked. So she had some cognitive developmental delays is what they call it. So we went to the pediatrician and they diagnosed her. Actually, we were referred out to a neurologist, kind of went down the road to diagnosis. And within a couple months, we had this very rare, ultra rare condition. And the doctor said, it's terrible. It is fatal. Most children don't live until past the age of 10. And her body is basically going to decline, kind of like Alzheimer's or ALS, only in a 2-year-old. So it's pretty tough news, kind of the worst possible news that you could have. And so when my husband and I, were told that, we went up to Jackson and talked to a doctor, Children's Hospital in Jackson, Dr. Brian Kermsey, and he had actually seen the disease before. And so on the drive up there, it's like a 3-hour drive, and we're like, okay, we're going to the Children's Hospital. This is terrible news, but like they're going to tell us to go to St. Jude, or like we go somewhere, there's some kind of experimental treatment somewhere, or we do something. And we got up there and he said, I'm sorry. He said, the disease is very rare. And so there is no treatment. And that kind of dived into the world of, is it science or is it business? And so for the next year, we flew to Europe. We met with scientists who had knew a lot about her disease. Because in these genetic diseases, hers is a single gene disorder. So it's one bad gene in every cell in her body, and they know what the gene is. So they know what the cause is. It's 80% of the problem is trying to figure out the cause. So I don't know if you're familiar with Sophia, who had DIPG. She passed away.
Yeah.
They can't figure out what the genes are for that. They haven't figured out the cause of that. And so when you don't know the cause, it's hard to figure out a treatment. So with our disease, they know the cause. And so they know how to treat it. They can do this thing called gene therapy where they correct a gene in every cell in the body. They do it now with sickle cell, with spinal muscular atrophy. They're bringing a bunch of diseases on board, but they will never bring an ultra rare disease on board because there's no money to be made by pharmaceutical companies. So I kind of, learned about how this business works. And I'm a business person. I own a staffing company. I understand about profit and loss. And so if you can't have a business model that says, this is how you make money off of this, no pharmaceutical company is going to invest in it. So we basically, as a community here in Ocean Springs and now across the world, have joined together to be the pharmaceutical company to push this clinical trial forward. So having said all of that, so as I entered into this world of rare disease, I realized, there's rare disease kids all over the place. We have some in Ocean Springs across the coast, and nobody knows about them. I'm kind of loud and noisy, and, I'm going to sit here and, talk about my kid all day long and post her pictures on Facebook, but not everybody's like that. And so we want to have a event where we bring awareness, not just to Willow's disease, but all rare diseases. These kids, all of their lives are important, and adults too. We want to recognize that. So the funds the money that we make from the walk and the run go to our foundation to help fund work for MSD and its related diseases. But the awareness that we're trying to build is for all rare diseases.
Wow, that's a lot to take in.
Yeah, I got a ton of questions.
I talked a lot. Yeah.
Yeah. Joey, before you start into that, let's flash her picture real quick on the screen, just so people can see this precious face here and know who we're talking about. Put a face to a name here. I mean, she is absolutely adorable. And as a parent, let me pull this down here so we can see better. As a parent, all of what I just heard you say is like the worst of news followed by more bad news and that's heartbreaking. Mentally to go there is like the amount of strength that you must have. I mean, that's amazing to have to go through something like that and be as vocal about it as you are and carry such confidence with it. I love the way you spoke about it. So Joey, go ahead.
Well, I was just going to say, you said you talk about your daughter all day, and all I did was mention this disease to my wife that we were going to have you on the podcast. And my wife Heather was like, "Is that what that little girl Willow has?" So you must be blasting it out over the internet. You must be getting the message out. But my number one question was, what classifies a ultra rare disease? What is that?
Yeah, so 200,000 patients or less is a rare disease. That's technically what a rare disease is. The ultra rare are in they don't really have a number for it, but it's in like the few thousand or less. Willow's disease, I mean, we're talking about, we know of about 100 kids worldwide. Now that's not a great number. There's probably about 1,000 because, it's not easy to diagnose and there's issues with that. But, a few thousand maybe, but it's still not a huge amount. And so when you think about diseases that, have tens of thousands of kids, there's more profit,
Right.
And that's pretty much what pharmaceuticals run off of is money.
Yeah. I mean, they're a business just like everything else.
To say it, but I guess the more sick people they can sell medicine and vaccines and cures or whatever you're selling to them, the more they get behind it. When you're only selling to 100 people compared to 100, 200, 300,000 people, it's a little different.
Right. You want the liver diseases and the diabetes and the kind of thing that affects, millions, they're, at the 10,000 level, there's enough money in there, but at the 1,000, 100 level, it's not. So what we figured out to do is we fund, and I could get a lot into the science, but we funded a mouse study. We're funding a natural history study. We're doing biomarker development. We actually have a biobank. We're doing all the work that a pharmaceutical company would do to de-risk it. So at some point, a pharmaceutical company will probably take it up because we've packaged it all up with a bow and de-risked everything. So, and paid for everything. But that's all we know to do. It's like we're basically, doing it ourselves.
Yeah. And that's tough to talk about people in a numbers and dollars and cents, and to hear you say it as the mother, explains to me that you understand that side of it, right? And that's tough, I'm sure, as a mom
It
to
is.
have to talk about it that way. I want to say that for people that are listening and thinking like, understand that she's the mom, like she understands this, that doesn't escape her the how that may sound, talking about numbers and dollars and how to market a drug or a treatment. So from the research that you've done, and I love to hear you're saying like you're being the pharmaceutical company, you're doing the work. Is there a dollar amount that says if we get here, the chances are really good to even get started or to make a breakthrough? And then also, is there federal grants available for anything like this to help fund something like this?
Right. Those are good questions. So the figure we're looking at right now is like $5 million. And, there's a breakdown of that. It's $1.5 million to go to clinical trial, a couple million to manufacture the virus vector. We have to do a toxicity study in a larger animal. There's pieces that we can do before them, but to get it's 5 million to get a treatment into kids at the clinical trial level. And that's not like some pharmaceutical company, because I'd say that and people are like, oh, the pharmaceutical companies are making $1 gazillion. No, that's not even involving a pharmaceutical company. That's paying money to like UT Southwestern or to a contract manufacturer to manufacture the virus vector. There's not a lot of upcharge in it. It's just raw materials and costs. It's kind of like making a COVID vaccine. It costs a lot to make the vaccine. It's just spread over a lot of numbers. So, and then your second question about NIH grants. So there is public funding. That's what the National Institute of Health is there for, is to fund research. There's a couple problems with that. And we are going to be pursuing some this year. We've tried before, and they're very competitive grants. And so there's usually at least 30 other people vying for the same pocket of money. And they say that they don't discriminate against 10 kids versus 1,000 kids. But if you're that grant reviewer, I think it is hard to like spend this money over here when you can spend this money over here and get the more bang for your buck.
Yeah.
So there is that.
So
and
the numbers
then
hit you again.
Yeah.
Unfortunately, the numbers.
I mean,
hit
they
you
won't
again.
say that, but I'm sure you can't help but think that in your head. And then the other thing is, you have to have proven data. So you can't just go to the NIH. And I've talked to our legislators about this. They're like, you just go to the NIH and they give you funding. And I'm like, you have to have some data to write a grant for. You have to have somebody to write a grant. Like I can't write a grant. The institution, the university would have to write the grant, the hospital where you have the scientist and the clinician. So they have to agree to write the grant, which means they have to have the time and they're willing to take this on. And then they have to have data that somebody had to pay for, which is us, and then they can turn that data around and put that into their grant, because you can't just write a grant without data. So it's just, understanding the industry and the way it is. We try every time, we'll try to get public funding as much as we can, but it's a long shot and it delays everything too. These kids their cells are dying every day.
Right.
I don't know if you've ever known somebody with Parkinson's or Alzheimer's or ALS, every day people get a little darker and the lights are going out. And so these kids have no time to wait for federal funding. So,
Yeah,
it's just
it's kind of like hurry up and
Yeah.
wait. It's kind of your situation right now, right? You
Right.
hurry up and wait and hope.
Well,
hope
I mean,
something
we're
happens.
fundraising and then we fund the next thing. And then we fund,
Yeah.
like this year, we're going to fund a natural history study, which has to be done. And so that's $300,000. So we'll fund that, and then we'll just fund the next thing and fund the next thing until we get there.
I don't know if you could see, I flashed a comment on the screen here. Stephanie Moran said that she just came across y'all and she thanks you for what you're doing. She found out that her son has a rare chromosome disorder. She found out last year. It's called, looks like THOC2. And she said, this is awesome that y'all are talking about this. So that leads
So
kind of me,
good.
to my next question is, what has been the response to other mothers? Like you mentioned, some of them may not be as bold or courageous as maybe what you are. What's been their response to knowing that you're out here being a voice for them and trying to create a community that they can be a part of?
Well, and I think it's positive. It's very positive. Everybody, we need attention brought to this. I will say, I don't know that I'm any stronger or bolder than any other parent out there. when you have a child that has these fragile medical conditions, that's your life, is just trying to keep your child alive.
Yeah,
And all of the advocacy you have to do just for your child alone takes up more than time that we have. So what I had is I had a business and I had a network. We live in an amazing community, and I had a lot of support from our Ocean Springs Rotary Club. I had a business network in New Orleans. I was just well networked, and so when this happened, I was like, oh, there's a problem, but I have a solution, and it's money. And everybody's like, yeah, let's do this. And so everybody came on board and supported. Not everybody has that, and that's what's very unfair about all of this. But so I will say that, I'm happy to be the voice for everybody. And I'd love to hear, we try to tell stories as much as we can amongst our other families. And then I love to hear other family stories, because every one of them, just to get a diagnosis takes so much courage and push. So, and we have a little girl that comes out that has elders Down syndrome. I never say it right. And she's in a wheelchair, and she comes out to the run, and she painted a zebra this year for our zebra run. And, I told her, I was like, it's sometimes, and cancer sucks, and I don't want to take anything away from cancer, but everybody kind of knows what cancer is. When I tell you MSD or Ehlers-Danlos syndrome or the chromosomal problem, you're all like, what? It doesn't, you can't identify it. But
we had to look it up. We really had to look it up before we started.
Yeah, you probably saw our website, which we created here. It's all done by families, and it's just, it's tough. But if we bind together, we can build awareness together.
Absolutely.
Yeah.
This run that you're putting on, the zebra run, what year is it? How many years has it been going on?
I think it's the 4th year. Y'all said the 4th year. I think that sign said the 4th year.
I'm going strictly off the banner, so I'll even let's flash it up again here, just to go let people see it. That's
I hope it's the 4th year. I hope that's right. Yeah, it's been a long few years and a long week. It's
I'm sorry, you got a celebrity host in here, right? On the photo?
Yes. So our friend Brian O'Halloran, who was one of the main characters in the movie Clerks, a Kevin Smith movie from the 90s. It's a black and white kind of cult classic. He's the one that he was at a convenience store, and he kept saying, I'm not even supposed to be here today. That was his famous line. Anyway, he's come down to the coast a number of times. He's friends with Jeremy London, which is how we met him. And he was on our board for a little bit. He's been a big supporter, and we asked him to come down and MC for the run. And so he's coming down to do that.
Well, that's great.
Yeah. And this run is in Ocean Springs, right?
Yes, it is in Ocean Springs. It's right on Front Beach. We start at Fort Maripol, and then you run to the bridge and then go halfway up the bridge and then come back down. So you don't have to run. I don't care if you finish it. I don't care what, you can come just visit with us. That's what a lot of people do. We stand there and chat and talk, and, but it's for a good cause.
Okay, let's see here. We got another.
Stephanie's asking for the info for the run. Yeah.
Yep.
Okay. Yeah. Good. Yeah, and we have a Facebook page, CureMSD, CUREMSD, Mary, Sam, David. We would, you can follow us on there and kind of see what's going on. And we have the event on there. We have a virtual event, so I didn't mention that. So we do have a virtual event if you're in another state. And I don't know if you saw it on there. We're trying to get all 50 states. We're currently at
like New Mexico and some northern states. So if anybody on here has any family there, definitely shout that out and get them on board.
Yeah, I think New Mexico is the odd one out over there. I know a single person in New Mexico, but New Hampshire, Vermont, Maine, all those, Rhode Island.
You got that first one, Jared? I think it's got the states that are blued out, and the white out are the ones that are the ones they still need people. I think Georgia's in there too.
I think Georgia is too. When it's surprising because we know a lot of people there, just nobody signed up yet.
Yeah, so we're going to try to get this on. I know it's on their page for sure, and it's all the blue states are the ones that they have people for, and all the white states are the ones that they still need people for. It's mainly up north. Yeah, there it is, right there.
Yeah, and the hearts are where our families are. So our MSD families are in those states. So we have Except for Georgia, we've got pretty good coverage in our family states.
Yeah.
So
Yeah.
If you're listening right now or paying attention to this, if you know any family or anybody that's in these areas that are in white, reach out to them, give them a call, share this link with them, and tell them to get on the virtual race. Now, what is the virtual race, Matt? You just log in and you do the race?
Yeah, you just log in, do your race. You get, we'll mail you a medal, whatever, a participation medal, and you can print a bib off. And if we haven't run out of shirts, we'll mail you a shirt.
Good deal.
The zebra.
I'm sorry. Go ahead.
I was just going to say, did you want me to explain what the zebra is? Why zebra?
Yeah, that was my next question. Why is it the zebra run?
Right. So when you go to medical school, they teach doctors, up and coming doctors, to look for horses, not zebras. So they basically, like, if you come in and you have symptoms, they want you to look at the most common thing. Like, we think it's this common form of cancer. We think it's cerebral palsy. We think it's, a common thing. Like, they tell doctors not to go down a rabbit hole of some rare disease, one-off disease, because you could end up, trying to find it. Previously, in years past, it's spent a lot of time trying to find a diagnosis. But what we're saying is now, with the genetic testing that's available, look for the zebras, because if you can get a diagnosis, especially with all these cures coming about and treatments, the treatment's not going to do any good if you aren't identified early. Most of the treatments don't fix anything. They just stop the progression. So, like with our gene therapy, we need to be treating babies when they're born. And so, we need early diagnosis. And so we're saying, pay attention to the zebras. So zebra is the symbol for rare disease. So that's why we use the zebra run.
No, Jared's a lot smarter than me. He went through med school, so he probably knows some of that.
Anesthesia school, but that is a common theme. My question is, with the zebra run, how do you if you participate, are people taking pledges to make money, like so much per how long they run? I know some runs work that way, or is it just donations only? Like, how is the structure of the financial part of it?
You just sign up. So you can do a no swag option for $15. Now, this is the virtual side. So the in-person run is $30. $30, and you think you become the day. I don't know if you can sign. I think you still sign up now and then sign up the day of is $30. The virtual run, you can do a no swag option for $15 or swag for $30. So we might try to do teams next year. We weren't able to. We just launched our virtual run this year, so that's kind of a new thing for us. But what I'd really like to do is do big runs in the cities where we have families. Like, we have some family in California. We have a family in Ohio that wants to do a run. I'd love to get big runs going in other cities. We'll work on that next year.
Yeah, that would be cool.
Yeah.
And so if people want to just make a donation, I'm assuming you'll take that as well, right?
We will take any form of money. We will take, Bitcoin or stocks or cars or whatever people want to give to us. Yes, you can go to curemsd.org and you can make a donation. If you, want to set up a Facebook fundraiser, we're on there. Those are super easy, and Facebook doesn't take any fees out, and the money comes right to us. You just go on Facebook, do a fundraiser, and pick CureMSD, and then you can contribute to that. We love it when people do birthday fundraisers for us. I usually try to tag people when it's their birthday if I can get around to it, but that's super easy too. You do it the same way. And we can raise quite a bit of money just off of Facebook. And we tell people, are like, and people aren't going anywhere. It's like, instead of buying me a beer, put $7 on my Facebook fundraiser and help cure these kids.
Mm-hmm. Absolutely.
Yeah. That's great. So curemsd.org is the best place to go to for donations, electronic donations as well. Mm-hmm. Okay, good deal. So people that are listening, I'm gonna say it again, curemsd.org. So go check it out for sure. The only other question that I kind of had sticking in my mind is that, we mentioned that it's going to take money to get all these clinical trials done and get through the process of working towards this gene therapy drug, right? Has anyone told you what that would look like once that, I mean, obviously you have to go through the testing, right? But is there any type of prognosis out there if you make it through this, as far as the barriers, the financial barriers that are ahead of you?
Yeah. So, there's a big one. Once you get to clinical trial, we could sit in clinical trial for a while and just pay for each dose. of each child that comes along and just raise the money to pay for each dose. We could try to go commercial. If we have a pharmaceutical company, that's what, of course they would want to do. And we would hope they would pay for that. If we don't have a partner, it's going to be hard to go because that's in the multi-millions. That's the big money, is to try to get final FDA approval. It's great because once you do it, then insurance will pay for it. You can put it out there in the open and insurance will pay for it. But gene therapy is, pretty new. I mean, it's not new. It's not a new treatment. It's been around since the 90s. But as far as getting commercial, I mean, they first did the first commercial approval, in 2017. So they're trying to figure out a business model. I will tell you something that's kind of fascinating. So along this way, one of the things that came up is well, why don't I start a pharmaceutical company? I know how to run a business. We need a pharmaceutical company. Why don't I try to get private investors and do a pharmaceutical company? So somebody hooked me up with the Tulane School of Business, and I talked to the MBA students, and they were all helping me kind of analyze this. And they got me on with a venture capital connector. So this was a guy who had investors. And so I pitched the whole thing to him. I was it's this rare disease, but we've done it in the mouse. It works really well in the mouse. The mice don't die. They live, they live like a normal life. We could cure kids. It's this beautiful thing. And then I said, and he's like, oh my, this is amazing. This sounds amazing. And then I said, it's a one-time treatment. So the kids get injected one time. And he stopped right there. And he's like, nope. He's like, I'm not interested. My investors aren't interested in a one-time treatment because it's not perpetual revenue.
Yeah. That's terrible to hear. It's more like, it's kind of like the sicker you are and the more we can drag it around, the more they're interested in.
Chris Rock had a bit about that, about pharmaceutical companies not curing anything anymore. That's an old one, but it's, man, that stings even more to hear that's a personal account of it actually being true, not just
and think about it from your pocketbook standpoint. Think about if you were an investor and you're like, okay, so I can invest in a gym that I get every month. Somebody's paying the $10 a month, or I get somebody who pays $1,000 once. It's I want that person to keep paying. And so from a revenue standpoint, it just makes sense. But from a realistic, let's cure kids and do the right thing, I mean, a one-time treatment, because there are some treatments that they've developed for similar diseases. So if you're if you're a medical guy, you might understand this, but she's basically missing, her enzymes are low that are supposed to process trash in her cells. And so there's other diseases that are very similar, like Krabbe and other ones, metachromatic leukodystrophy, that have one enzyme deficiency. And so the thought is, for those diseases, couldn't you just give them the enzyme? Versus we're talking about fixing the problem, but couldn't you just give them the enzyme? So they have these enzyme replacement therapies. That's what they're called, ERTs. But they're infusions. And so they get them every week. And so they go to the doctor every week and they have to get an infusion, or somebody comes to their house. Well, those cost $500,000 a year. And so it's that's cheaper than the $5 million, which, we would treat probably 6 kids with that. But it's one time $5 million versus $500,000 a year, so it's just you got to think about it. And we just have to create a model that's going to somehow, whether it's publicly funded, because ultimately what's happening with these kids is we're all paying for this. So Willow's care, my husband's retired military. So he has TRICARE, and then she has Medicaid. So as taxpayers, you're paying for her care. So it's probably going to cost $2 million before she dies, because her chair that she sits in costs $15,000. She gets nurses, she gets medical supplies. She goes to the hospital for 3 weeks at a time. You're paying for her care as she dies. So from a financial standpoint, it would be better to cure these kids, because we could cure them for $500,000 a piece, than it would be to pay the $2 million. So as a society, we need to fix this, because we're spending trillions of dollars on these kids while they die, just doing palliative care, when we could cure them and they could have lives. They could live.
Yeah, that's tough.
Yeah, that is, and those are the large conversations that I would hope that some of our elected officials are having, but you never really know, right? Common sense discussions like that.
I went to one of our very kind of politicians, and I was like, because I said, the NIH does have funding, and he's like, "What's the NIH?"
Oh
I
no.
was like, "Oh,
Oh no. I hope he wasn't on any type of
Woosah, woosah,
committee. I
woosah.
hope he wasn't
yeah,
doing healthcare committees at all.
yeah, yeah."
Well, that's tough.
I want to ask another question, and I hope this doesn't offend anybody or hurt anybody's feelings, but it seems like, and I don't want to. It seems like this is happening a lot in the Ocean Springs area. These rare diseases. Is there anything to that, or am I just seeing this more because?
Yeah. So this is my opinion. So there's no more prevalent. I mean, we only have one child with MSD in the state of Mississippi. It does happen to be in Ocean Springs, but I think there's a couple things that you're seeing. One, if there is a genetic component to diseases, then there could be pockets of genes, people related, where there could be more of a prevalence.
Right.
But they did that study on DIPG.
Yeah.
There was a hotbed in South Carolina that had like 24 kids within a subdivision. I mean, and they couldn't find any, environmental, link to it. It's probably a combination of genetic and environmental. It may be something with turning genes on or something with some kind of environmental thing. But for us, if there's no, it just happens to be coincidence. And I also think it's also who gets diagnosed. So Angel Myers is very, very well known and vocal, just like me. So, you hear about these diseases, but like there's a teacher at Oak Park, where she's retired now. Her daughter died from a similar disease that Willow has 25 years ago. Nobody knew that. Nobody, no, even her coworkers didn't know it. And so when Willow was diagnosed, she came up to me and she was like, my daughter, her baby daughter, had died from a rare disease when she was 3, and she never spoke about it. I mean, people just don't. A lot of people don't talk about it.
Yeah.
Social media changes that nowadays too. So
yeah, it does. And we're all trying to do GoFundMes and trying to cure our kids. And yeah, things have kind of blown up that way. But it's always been there. We just, you just didn't know. I mean, our board of president had a daughter that was my age. So like she was born in 76, I think. So she's a year younger than me. So she was diagnosed with MSD way back when.
Yeah. Yeah. Well, that's tough. We really appreciate you coming on here today and talking about it and all the work that you're doing. I'm going to put this back on the screen again for people that are watching and read it out loud for the people that are listening. It's the 4th annual Zebra Run for Rare Disease Awareness. It's going to be April 17th, 2021. It's a 5K and 1 mile fun run. If you can't make it out, they have a virtual component. And if you'd like to make a donation, in addition to making the run or not making the run, go to curemsd.org and help them out. It's a great cause for a very, just as tragic situation that these families are trying to get awareness out about.
But there's hope. There's hope on the horizon, and we're gonna, I'm not giving up. There's going to be a clinical trial, and we'd love to have people be a part of that. I mean, people are excited, I think, to be involved and be part of something. Even though it's small and just a few kids, it's like you're going to make a huge impact by being, with us. If you go to the page, you can sign up for our newsletter. That'll keep you in touch. Go to our Facebook page and follow us there. And, we'd love to have people who want to volunteer or donate or connect us with people. And we'll need Zebra Run sponsors next year. If you have any ideas for companies that want to sponsor. So lots of opportunity to help.
For sure.
And thanks for being on our show. We thank you a lot for bringing us
up. Yeah. Thank you so much. Thanks for figuring out a time. I'm glad we connected before the run.
Yeah, we were juggling a little bit for sure.
Yeah.
All right.
Well, you have a great evening, and we wish you the best on the run as well.
Yeah.
Okay. All right. Great.
And
I just leave studio, right? Yeah. Okay.
Yeah, I can get it right here as well. All right.
Okay. Thanks. Bye-bye.
See y'all later.
Well, yeah, that was that's. Man, please go check it out, people that are still there, and support a great cause. And we want to thank y'all for tuning in and listening. And Joey and I will see you on the next one.
Yep, I'll take it easy.